So you can see distinct thyroid swelling in these patients in bilateral lobes of thyroid gland. And now I am palpating the swelling. In bilateral lobes there are distinct nodular like feeling. It is firm in consistency while feeling. So I am pressing on one side of the thyroid gland and feeling on other side. I am feeling how many swellings are there and consistency of it, but I couldn't find more swellings. Like I found only one node swelling in bilateral lobes of the thyroid gland, one swelling in left and one in right. And here you can see the swelling is prominent, even it is, we can see distinctly. And now I am sculptating it, and for any bruit, because in Graves disease there can be bruit because of the hypervascularity of the gland. There is increased blood flow in the inferior thyroid artery, but there were no bruit in this patient. Now I am asking to ask the patient to raise hands upwards to look if there are any retroexternal extension of the thyroid or not. And here you can see that there is no facial congestion, so this sign is negative. So now let's examine her eye. And what you see in this patient, you can see there is distinct, you can see there is wide palpebral feature which is called Dalrymple sign. And when asked patient to look downwards, you can see there is a lag of the upper eyelid. When looking downward, you can see there is lagging of the upper eyelid. And when I ask the patient to look upwards from the down position, so let's see in this patient, I am asking her to look upwards. So here you can see, what do you notice? There is lagging of the globe compared to the upper eyelid, and this is another sign of thyroid eye disease. And so what are the other signs of the thyroid eye disease? One is called a still wag sign, which is infrequent and incomplete eyelid closure. And another is Coker sign, which is a retraction of the lid during attentive fixation. And here you can see, when I ask the patient to close eyelid, there is fine tremor of the upper eyelid, which is another sign, which is called Rosenbach sign. So what are the other signs? Another signs are edematous eyelid swelling, and if you auscultate over the eyelid, there can be bruit. This is another sign. Another sign is Mobius sign, which is due to poor convergence of the eyes.